A state board has given its initial approval to a new nursing program at Roxbury Community College. Last year, the board withdrew accreditation for the program after high turnover in its leadership and problems with student achievement. Scheduled to begin next year, the program has new curriculum and leadership. To tell us about the changes and opportunities in the health science field is the college president, Dr. Valerie Roberson. Thank you very much for being with us, Doctor.
My pleasure. Thank you.
Doctor, I want to ask you about the changes in the program here because you do have a new leader, but it seems that you did a lot more than just put one person into the job. So what went on in putting this into better shape?
Well, we've been working on this for really the better part of a year now, if not long before that. And we've always been supported by an active advisory board who are professionals within the field who give us advice about the curriculum. So that was their help that enabled us to create a brand new curriculum. We also, as you might remember, we invested a lot in the physical labs for the nursing program. And so we have about $13 million of investment in our physical space. And now we're embarking on the process of hiring a brand new faculty.
One of the other things that's going on, and this was planned long before the pandemic, but right now a lot of us are concerned about air quality in buildings, and you were working on that.
Yes, absolutely. We've had other renovations across the entire campus, and one of the things that we were able to improve was the quality of air and our air filters throughout the campus. So glad that we made that investment early on.
I want to ask you about something that must be going on in the minds of people who are looking into the field of nursing and maybe even some other health science fields. And that is about the difference between a 2-year program and a 4-year program. Nurses in hospitals, a lot of them go to 4-year programs. So some people might be wondering, is it worth it to go to a 2-year program?
So I think that there are differences in terms of the jobs that are available, depending upon which degree you have, the associate's degree or the bachelor's degree. But the fact of it is that both sets of nurses take the same state board and they have to pass at the same rate. The difference is that with a bachelor's degree, you still have other gen ed requirements that you have to take. So eventually, I think that most nurses will go on and get their bachelor's degree. The associate's degree gets your foot in the door, gets you employment, and many of the hospitals have a tuition reimbursement program, and so then you are able to finance your last 2 years.
Well, one challenge that's faced by many community colleges is you have students who need some remediation, especially in math. This was an issue with the nursing program before, and I guess one of the things that you found out was you had to do it in a different way. How is it done differently, and how much better does it work?
So what we've been able to do is to find that in a lot of our programs where students have difficulty, they need more time with the instructor. And so in many cases, we have double the amount of time. You're talking a little bit about what we've done in math to increase student success. We found that when students had more time with the instructor, that they were able to actually exceed other pass rates in terms of, the students that take the college level courses and that are able to complete it successfully within a semester. We've increased that up to a good 65% of the students are able to take that college level course, even if they haven't had math success in the past. We've also provide a fair amount of free tutoring support. And in some cases, the tutors work directly with the instructors so that they know the things that are covered in class, and they can then take that extra time with students outside of class and enable those students to be successful as well.
Well, one other thing about a 4-year program, I think a lot of that work has to be done during the daytime. What about your 2-year program and accommodating the needs of people who might have to raise children or work at least part-time?
Mm-hmm. So this program that we are starting very conservatively. So the first class will be full-time and students will really be taking most of their classes during the day. But in light of the pandemic, some of the classes will be offered using technology, so they might not have to come to campus every day. that distance ed focus has really enabled a lot of students that you talk about, that they have children or have families or jobs that need to be flexible. Those classes are a tremendous help to keeping students in the classroom and able to persist till the end. And so there are nursing classes that will have the distance education, although some classes will still need to be on campus. And in this field, you can understand that students are also learning about how to be safe within a healthcare environment, and they're practicing those skills on campus before they're actually in a hospital. So I think that that's ultimately a great thing for the students.
Well, with the emphasis on COVID-19 right now, there's clearly more need for nurses, at least to deal with that particular challenge. But what about the broader picture about the need for cultural competency? How does that affect what you're doing at Roxbury Community College?
Well, I think that that's one of the hallmarks for our campus is that we have a very diverse student body and a diverse staff as far as administration is concerned. Our goal is to ensure that individuals from the side of town that we deal with, Roxbury, Dorchester, Mattapan, those areas, the students have access to healthcare careers. And especially when you think about when you're sick, you want someone that can speak your native language, or that understands some of the cultural needs that you might have in healthcare. And that's where our students really excel, because they typically are from immigrant families, or they are speak a second language. And those are strengths that allow them to do their very best in the healthcare environment.
If you think a little bit beyond the people who might be registering for classes next year, maybe people who are a bit younger, making their minds up about what to do in the future, what would you say about healthcare, especially given what people in the community around you have been through in recent months?
Mhm. I think we need healthcare workers more so than ever before. And we need all phases of healthcare. So the people that are the nurses, but the x-ray technicians, all throughout the whole continuum of healthcare. And I think that we need more people that are focused behind the scenes in research and the lab work. And so there's just so many positions that are necessary for us to keep ourselves well as a society, that I urge students that have an interest to come and talk to us about the range of healthcare programs that we have available at our college.
And maybe you can spell that out a little bit more, because in addition to nursing, what kind of programs are you talking about?
So we have some very short-term training programs that a student can finish in 16 weeks. Those would be phlebotomy, the ones that draw the blood, or medical assistants. Those are the folks that work in the records and record keeping in the doctor's offices. We also have pharmacy tech, rad tech. We'll be looking at starting a new program in anesthesiology technology. And so our goal is to continue to be a source where individuals that want to learn how to work within the healthcare field have a great number of options, and we're going to support you to be successful.
What about affordability?
So community colleges are your best bet. I mean, generally our tuition is about $6,000 for a full-time student to pursue classes over 2 semesters. Nursing, those programs tend to be a little bit more expensive because there are fees associated with those courses. But it's the most affordable option that you have. And one of the things that's important for us is we try to encourage students to consider the fact that by going to a community college, you don't have to take out a loan. And you can actually finish our programs without acquiring debt that's going to just follow you until you're able to pay that debt off. So at least take those first 2 years at an affordable price. We also have a fair amount of scholarships and support, especially now in COVID. There's so many institutions that have been very gracious to RCC and providing money for scholarships for our students. So we really are able to serve most students between the combination of scholarships and financial aid. Most students don't have to come out of their pocket to attend RCC.
Now, for people who want to look into at least the nursing program in more detail, I think you have some virtual events coming up pretty soon too.
We do, and I would advise individuals to look at our website, rcc. mass.edu. There's information about applying for nursing. There's information sessions. Registration is starting now for spring classes. And if you're interested in nursing, you may need to take some prerequisites. So it might be a good idea to come on over, have that discussion so you know what you need to take in the spring so you'll be ready to start in the fall.
Well, thank you very much for taking the time to be with us.
Thank you so much for having me. It's always a pleasure.
That was the president of Roxbury Community College, Dr. Valerie Roberson.